Good afternoon and welcome to Joint Camp. My name's Sarah. I'm one of the nurse case managers, and I work with a couple other, or actually just one other nurse now, Katie. Listed up on the screen right now are our contact information, or is our contact information. Both numbers are direct telephone numbers to Katie's and my desks, so those are good numbers to keep handy. When Katie and I are not in the office, those numbers are going to roll through to a cell phone on call. So we do like you to know that one of us will be on call for you if there's urgent matters that come up before or after surgery. I do like to go over our refill policy right now. All of you having surgery with us will go home on some type of a pain medication. There are some regulations on pain medication. So a couple things to keep in mind. If you do need a refill of your pain medication, which most people will, just make sure that you do call us to request that. We don't accept requests for pain pill refills via text or by email. Another thing is we do not refill over the weekend. So we actually stop refilling narcotic pain medication at noon on Friday. So I always say Thursday's the day to look at your pill bottle, look at the count number of pills in your bottle, make sure you have enough to get you through the weekend. If you do not, feel free to call Katie or myself. If we don't answer, leave us the message. Again, as long as that's before noon on Friday, we'll make sure and get that prescription refilled for you. Couple benefits to having this type of surgery in the outpatient setting. Joint replacement surgeries used to solely be inpatient. You'd stay in the hospital for several days. Over the last several years, they've been moved much towards the outpatient setting. And there's a few reasons that we really like this type of surgery in this setting. Number one is we keep our infection rates really, really low. You're only with us in that medical surgical type environment very short term. I usually estimate for patients you'll probably be with us about 6 hours in total on the day of surgery. So your exposure to everything in that medical environment is very, very low, which helps us keep our infection rates down. Also going home and having a more relaxing environment in your own home with your own people, your own furniture, your own places to sit and lay down, your own food. We think that that's usually a much more comfortable place to recover. And then, of course, we hope that having access to one of the nurses here on a routine basis is also a benefit to you. This is your first joint replacement. A lot of people want to know what type of activities they're able to get back to after they're healed and how long the joint replacement will last. Obviously, you guys are a younger population in most situations having this type of surgery. We do estimate for most people you're going to get about 20 to 25 years of use out of this new joint. Now, that can depend very much on how you use it. Activities listed in red that are up on the screen are activities we don't necessarily recommend that you take part in after a joint replacement. Those are your high-impact repetitive activities like running, jogging, contact sports, or high-impact aerobics. It certainly isn't that you cannot run after a joint replacement, but those high-impact repetitive activities can wear out your new joint just like they do your native joints. So those are things we don't recommend that you pick up, especially if you're not active in those types of things now. Listed in green are activities that are going to be fine to get back to, again, once you're healed. Vigorous walking or hiking, skiing, tennis, or pickleball. A lot of people ask about pickleball, swimming, golf, biking. Any of those low-impact activities are going to be fine. Walking will be part of your recovery, whether you're having a hip or knee replacement right from the start, but getting back to some more of these aggressive low-impact activities are things you'll be able to do as you're more fully healed. And the best thing about these surgeries is in general, you get really, really good pain relief, again, after full healing is done. We do ask you and your caregiver to participate in a lot of things pre-surgery, so getting ready for surgery. Number one priority really is making sure you do have a good recovery coach, somebody designated to kind of help you out at home after surgery. There's a lot of things to remember before and after surgery, and it's always helpful to have an extra set of eyes and ears. So having your recovery coach, and coaches, we really do recommend that, of course, you're there on the day of surgery, and that you stay around with the patient those first 2 or 3 days after surgery pretty consistently. We will ask you to see your primary care physician before surgery. That is a requirement to have surgery and to have anesthesia. That appointment is called an H&P, or a history and physical. That's required to be within 30 days of your surgery time. Along with meeting with your physician to make sure you're healthy enough for surgery, we'll ask them to do some lab work for you, and then maybe an EKG or a heart tracing depending on your medical history. You may also be asked to see a specialist. In particular, if you already see like a lung doctor, a pulmonologist, or a heart doctor, a cardiologist, we may ask you, or your primary care physician may ask you to go ahead and see that specialist in preparation for surgery as well. If you don't have a specialist that you see routinely, or this isn't familiar to you, it's probably because in your medical situation it does not apply. There are some things to pick up next time you're out at your pharmacy or your grocery store where you pick up your over-the-counter medicines. Tylenol products are excellent to be used before surgery, and a lot of times we'll recommend Tylenol after surgery as part of your pain management. So extra strength Tylenol, acetaminophen is the generic for Tylenol. If you don't typically have that type of medicine at home, that's a good thing to pick up. A lot of our doctors will use low-dose aspirin after surgery as part of our blood clot prevention. So again, having that aspirin 81 milligrams on hand at home. Then you also might want to pick up some products for your bowels. Constipation is a very common complaint after surgery because of pain medication. A lot of times we're going to recommend that you use some type of a stool softener or maybe even a laxative temporarily after surgery, especially if you're taking your painkillers. So any of the over-the-counter brand is fine. Medical equipment to pick up before surgery, crutches or a set of a set of crutches or a walker. We're going to ask you to use one of those pieces of equipment for about 2 weeks at least after surgery. Now, if all you have is crutches at home, in some situations you can borrow a walker from our surgery center. If you plan on borrowing a walker, just let us know ahead of time so we can make sure one is available for you. Ice machines are available through our office as well. If you have interest in an ice machine, just let Katie or myself know. You will need to have a way to ice down the leg after surgery to help with inflammation and swelling. If you prefer not to have an ice machine, just having a couple ice packs or gel packs on hand at home is a good idea. And we'll talk a little bit more about shower chairs and bathroom equipment here in just a minute. We do ask all of our patients to see physical therapy prior to surgery as well for a training session. That is to do any walker crutch training that you might need to walk with that device properly, any stair training that you might need if you have stairs in your home, and then to learn your basic exercises that you can do as part of your recovery. A little bit more about our infection control. There are a couple things that we're going to have you guys do at home in preparation for surgery to help us keep that infection rate down. We will be sending in a prescription ointment to your pharmacy. It's called Mupirocin. I ask you to pick that up, and we're going to have you use that twice a day for 5 days before surgery. So instructions are just use a small amount of ointment, put it on a Q-tip, rub it on the inside of each nostril, morning and evening for those 5 days before surgery. The second thing is we're also going to have you pick up a surgical soap. A lot of times it's just over the counter called HibaCleanse. I'm going to have you pick that up and use that once a day in your shower for those same 5 days before surgery. So get in your shower, wet your skin with the shower water, then wet your skin from the neck down with the surgical soap. We don't recommend using the soap on your face or hair, and be careful in private areas. It is a harsher soap, but we do want that soap on the majority of your skin from the neck down. Let it sit on your skin for 2 minutes and then rinse it off. This is a soap that can tend to dry out your skin, so feel free to use lotions or creams on your skin if you normally do, up until that last shower before your surgery. And then we're going to ask you not to apply any products to your skin or hair. In your shower, if you're applying this soap with a washcloth, we recommend that you use a clean washcloth each time, dry off with a clean towel. We do recommend consider going to bed the night before surgery, clean bed sheets, clean bed clothes if you wear them. What the majority of both the nasal ointment and the surgical soap are geared towards is cutting down on staph bacteria, which can cause infections after surgery. Now, every single one of us has staph on our skin. It's completely normal. But again, we want to kind of cut down on those counts coming into that surgery environment. And then some of us may have a different type of staph bacteria that lives in the mucous membranes of our nose. So that's what the nasal ointment is for. And again, the nasal ointment will be a prescription that's sent to your pharmacy. A little bit more about infection control. Your diet and nutrition can be really important in preventing infections and helping with healing after surgery. Depending on who your surgeon is, he may have recommended that you start taking some protein products like protein drinks, protein powders, Ensure Boost. Those products are great. What I typically recommend is any way you can increase or boost up your protein in your diet, the better. So whether it's through those protein shakes or adding in some lean sources, lean meats, green leafy vegetables, nuts, beans, peanut butter, those types of things. Anything you can do to boost up your protein before and after surgery, the better, especially in those couple weeks before and couple weeks after. It's really important to stay hydrated. So water is going to be great, but having some hydration products on hand at home like Gatorade, Powerade, Pedialyte, those are going to be really helpful, especially after surgery. And then fibers, paying attention to your fiber intake, especially after surgery, where you may be dealing with some of the constipation related to the painkillers. So those are kind of three of the dietary things we have you pay attention to: proteins, hydration, and fibers. If you wear nail polish of any type, we do want nail polish off your fingers and your toes for surgery. And if you're a person that goes and has manicures or pedicures in the salon, we're going to ask you not to have a manicure or pedicure for about 3 to 4 months after your surgery. Also, dental work. Dental work is one of those things that we just a lot of times have scheduled routinely. You know, we have our checkup or our cleaning every 6 months or so. We do ask you to try to avoid any non-emergent dental work for about that same period of time, about 3 to 4 months. When you have that first dental appointment scheduled, just make sure, call Katie or myself. We're going to ask you to take an antibiotic prior to any type of dental work, even a cleaning, for a 2-year period after surgery. So try to delay any dental work for about 3 to 4 months. When you have that first appointment scheduled, call Katie or myself. We will make sure and send in an antibiotic for you that you're going to take 1 hour before you go into the dentist for that 2-year period following your joint replacement. We ask you not to do any hair removal on the surgical leg, so don't don't shave, don't use any waxing products or hair removal products at all on that surgical leg. Now, if you shave your head, you shave your armpits, you can shave your other leg, but just don't do any hair removal on that surgical leg for at least 7 days prior to surgery. That's because if there are any breaks in your skin, rashes, skin burns, anything like that in the area of surgery, that can actually delay your surgery. So just avoid that. And then if you use any type of nicotine product, cigarettes, vape pens with nicotine, smokeless tobacco, nicotine can constrict your blood vessels. It can delay your healing a little bit, especially after surgery. So we ask you to try to cut down or avoid those nicotine products as much as you can for those 2 to 4 weeks before surgery and 2 to 4 weeks after surgery. Preparing your home for after surgery. So obviously you guys are, again, only with us for a few hours on the day of surgery. A few things to keep in mind for easy recovery at home. You are going to need to take it easy at home, a lot of resting. So think about places you can sit comfortably. Sitting on anything that's really low sitting or really, really soft where you sink into it can be difficult to get up and out of after a knee or hip replacement. So think about places that either have a little firmer seat or that sit up a little higher so it's easier for you to get up and out of those seats. It is important to obviously avoid falls. Nobody ever wants to fall ever, but especially after surgery. So think about the pathways in your home where you're going to be walking frequently, kitchen, bathroom, bedroom, back and forth in those areas. Make sure all your walkways are clear of any clutter. There's no cords or anything draped in the walkway that could cause a trip and a fall. We do recommend picking up smaller rugs like your entry rugs, bathroom, kitchen rugs, those easy to pick up rugs. You might not be picking up your foot quite as normal. Those first few days, the leg can feel a little heavy initially. We don't want anything that's an extra opportunity for you to catch your crutch tip, your walker wheel, or your toe and cause a fall. So picking up those extra smaller area rugs is something, or smaller rugs, we recommend picking those up. Don't be surprised if you're getting up at night quite a bit those first few nights to use the bathroom. We give you a lot of fluids during surgery, and the way you get rid of that is in the bathroom. A lot of times you're going to notice that more at nighttime those first few days. Make sure if you're getting up at night, maybe to have a light that you could flip on quickly. Make sure you're always using your walker, your crutches for all of your walking those first couple weeks. And make sure if you're laying down, give yourself a little bit of time so you can sit before you stand right up. So make sure if you're laying down, again, sit for a minute before you stand up to help prevent any feeling lightheaded or anything like that after surgery. Meal prep, if you're the cook in the home, a lot of people will prepare meals ahead of time. Next time you're at the grocery store, you might want to pick up some easy, quick, snacky type meals or bland foods. Don't be surprised, patients, if you're not super hungry after surgery. Having kind of a low appetite is pretty common, but it is important that any time you take your pain medicine, you do eat something. So having some easy, quick, snacky type things are a good thing to have on hand at home. Bathroom safety, we do, again, recommend picking up the smaller rugs in your bathroom. Caregivers always say make sure that bathroom floor stays clean and dry. I don't like to tell people to buy a lot of equipment for surgery, but depending on your height and the height of your toilet, the toilet seat may seem very low sitting after surgery. So toilet risers are a piece of medical equipment that you can purchase fairly inexpensively that can be really helpful after surgery. So toilet risers is an attachment that either goes over your toilet itself, raises the seat up 4 or 5 inches, and provides handrails. So you can use your hands or arm strength to get up and down from that toilet seat, or an attachment that goes right to the lid of your toilet that, again, raises it up a few inches, provides handrails. You can purchase these over Amazon. You can get them at Walmart, Walgreens, even Home Depot and Lowe's in their bath bar section. Typically, you can pick up this type of equipment fairly inexpensively. Shower safety, most of you will be going home with a waterproof dressing over your incision. Makes showering really easy. We do recommend that you wait until the day after surgery for your first shower. Other things to keep in mind is make sure somebody else is in the home with you, so don't choose to do your shower when you're completely alone, that very first shower when you're completely alone, and keep your shower water more on the warm side instead of real hot showers. Staying in a real hot shower right after surgery, where some of those medications from surgery may still be in your system, can make you feel a little lightheaded and dizzy. So we just recommend keeping that shower water a little bit more warm water those first 3 or 4 days. 7 days before surgery, we're going to ask you to stop anything that can thin your blood. Now, if you take a prescription blood thinner like warfarin, Coumadin, Xarelto, what's another one, Eliquis, you will get specific instructions on how and when to stop that medication. There are some over-the-counter medications that can thin your blood as well, and that's anything in the anti-inflammatory family. So we do ask you to stop any products like aspirin, Aleve, ibuprofen, Advil. We also ask you to stop your prescription anti-inflammatories like Mobix, Celebrex, Meloxicam. So any of those anti-inflammatories, please stop 7 days prior. We also ask you to stop your herbal supplements and some of your vitamins. A lot of our herbal supplements can thin the blood as well. So we kind of say basically avoid any of those over-the-counter supplement type things for about a 7-day period as well. Now, if there are some of your vitamins that you really want to continue to take, there are plenty of them that are completely safe. Just call Katie or myself, and we'll be happy to let you know if some of those vitamins that you're taking are okay to continue. That week before surgery can be a little painful because we're taking you off of those anti-inflammatories, which a lot of people use. The over-the-counter option for pain relief before surgery is your Tylenol products, or again, the generic for Tylenol is acetaminophen. That's in a different category of medication and completely fine to continue to take up to the time of surgery. We actually recommend what's called a Tylenol preload. So for most people, if you have no issues taking Tylenol or any restrictions on Tylenol use, we actually recommend that you start dosing with Tylenol pretty regularly to help us kind of prepare you for surgery and help set your body up for some better pain management after surgery. So what a Tylenol preload is taking full doses of Tylenol for the 3 days leading into surgery. Full doses of Tylenol for most of us is going to be 4,000 milligrams every 24 hours. Easiest way to do that is by taking 2 extra strength Tylenol every 6 hours. Now, again, if you have restrictions on Tylenol dosing because of other medications you take or other medical conditions, please go ahead and continue to follow your normal restrictions on that. This is optional, but something that we have found has helped people with their pain management. If you choose to do this at home, just make sure the last dose of Tylenol that you do take is at least before midnight on that night before surgery. You will be getting some pre-op medication at the surgery center, part of which is Tylenol. So just make sure that last dose at home is before midnight. The day before surgery, you're going to get a call from the surgery center to find out your time for surgery. Now, if you have a surgery on Monday, you'll get this call on Friday. Some general information about day before your surgery: kind of keep the food light on that day. If you go to bed or have a real heavy dinner the night before surgery, it can make you feel a little sick before and after surgery. So kind of just keep the foods light, soup, salads, easy digestible foods. Do ask you to avoid alcohol for at least 24 hours prior to surgery. So no alcohol. We do want you to come into surgery as hydrated as possible. Generally, you're going to get the instructions on nothing solid after midnight. So nothing solid, no pills, no food after midnight. Two things you can do to make sure you come into surgery hydrated is, number one, consider having one of those hydration products like Gatorade, Powerade, Pedialyte the evening before your surgery. If you choose to do that, again, just make sure that you have that product done before midnight. After midnight, you can continue to have clear liquids, so midnight up until 2 hours before you come in for surgery. So if you find out your time to arrive for surgery is 8 a.m., from the time of midnight up until 6 a.m., or 2 hours before your report time, you can continue to have clear liquids, maximum of 18 ounces. And the things that we consider clear are going to be water, of course, black coffee, and plain tea. So if you're a person that really needs some caffeine in the morning, you need your cup of coffee, that's going to be just fine. Just don't add any creams or sugars to it, and make sure that no more than 18 ounces, and it needs to be done at least 2 hours before you come in for surgery. And then the nurse that calls you the day before surgery is going to let you know if there are any of your prescriptions that they want you to take the morning of surgery with a sip of water. And those medications tend to be things like things for your heart, maybe your blood pressure, stomach, or thyroid. But again, the nurse that calls you the day before your surgery will let you know if there are any of your morning medications they want you to go ahead and take with a sip of water. Day of surgery, if you would like to take a shower in the morning of your surgery, that is fine. If you do shower in the morning of surgery, we just ask that you repeat that surgical soap that we've recommended. Whenever that last shower is before your surgery, the evening before or the morning of, just make sure you don't apply anything to your skin or hair after your shower. So no hair products, no makeup, no lotions or creams to your skin, no deodorant. I ask you to leave all your jewelry at home, and then it is completely fine to brush your teeth on the morning of surgery. What to bring with you for surgery: photo ID and insurance card. If you wear eyeglasses, you're welcome to wear those. Hearing aids, dentures, any of those things you can wear to surgery, but we will need them removed for surgery. So either bring a case, plan on leaving them with your caregiver, or we can leave them in your case in the surgery area, but I usually recommend you leave them with your caregiver. If you do wear contact lenses in your eyes, we ask you not to wear contact lenses on your day of surgery. People who have sleep apnea, we will need you to bring your CPAP, BiPAP, or any sleep mask you typically wear. A lot of times we're going to have you wear that while you're waking up from surgery, so please bring that sleep equipment with you. Clean, loose-fitting, comfortable clothing, so sweatpants, pajama pants, shorts, whatever you're comfortable in, something that's real loose and easy up and down. We do suggest actually bringing extra pair of bottoms with you, so an extra pair of shorts or pajama pants, and we'll talk about why here in just a minute. Slip-resistant shoes. You will do some walking after surgery before you leave us for the day. So just think about something that's sensible on your foot that fits your foot well. We're not big fans of really open-toed or open-backed shoes or flip-flops or anything like that flops on your foot that could potentially cause a trip. So just kind of think about something sensible for your feet. And then your walker or crutches. It is our general preference that you have a walker for the day of surgery, but just go ahead and bring your equipment with you in the car. You don't have to bring it into the surgery center with you, but when we get you ready to go home, we're just going to want to see that you have that ready to go when you do get home. And again, in some situations, if you need a walker, you may be able to borrow one of our walkers from the surgery center. So just let Katie or I know, and we're happy to make sure there's one available for you. Basically, everybody's arriving at kind of their designated surgery time, so staff will be expecting you. Initially, we're just going to go through some paperwork with you guys, make sure we have everything correct as far as insurance goes. Patients and caregivers come back with the nurse for pre-op time, so caregivers, you can stay with the patient up until the time we start anesthesia. Patients' prep time for surgery is really, we'll have you change into a surgical gown. We'll have you go into the bathroom and empty your bladder. We do not use catheters for this surgery, so we'll have you empty your own bladder. The nurse will get your weight the morning of surgery. Some of our medications that we give for surgery will be somewhat based off of your weight. And then the nurse will go ahead and get an IV started for you. We're not going to give you any medicine in that IV. You may just have a little fluid running through there. We don't give any medications until you speak to both of your doctors. So the anesthesiologist is going to come back and speak with you and your caregiver about the plan for anesthesia, and the surgeon will come back and meet with you guys as well. You'll have an opportunity to ask any questions of either doctor that you have about anesthesia or the surgery itself. Once all your questions are answered and all the paperwork's done, caregivers, we're going to ask you to head back out to the waiting area. Patients, this is where we start your anesthesia. Very first thing we give for anesthesia for our hip or knee replacement patients is some medication through your IV to help you relax. If you're having a hip replacement, after that medication, we're going to wheel you into the surgery area where you'll have the rest of your anesthesia. Knee replacements, you're going to have one extra layer of anesthesia. So after that medicine's given through your IV, the anesthesiologist will come back in and give you an injection right around the knee itself, the knee that's having surgery. This is called a regional anesthesia or a nerve block anesthesia. The anesthesiologist uses an ultrasound machine around that surgical knee to locate the bundle of nerves that basically affects the surgical knee itself. They're going to use, again, that ultrasound machine to then inject those nerve bundles with a long-acting pain medication and numbing medication. So that's going to provide some good localized pain relief to the knee itself for usually about 12 to 24 hours after surgery. Knee replacements. After that nerve block is given, then we're going to move you into the surgery area as well, where you'll receive the rest of your anesthesia. That's really the only part of this presentation where there's a little bit of a difference between the hip and the knee replacement patients. Knee replacements just have this one extra kind of layer of anesthesia. In most cases, whether you're having a hip or knee replacement, we do plan on giving a spinal anesthesia. Now, there are some health situations and some past medical history and those types of things or surgical history where you may not be a candidate for a spinal anesthesia. In that case, you would receive a full general anesthesia. But a spinal anesthesia is a single injection given by your anesthesiologist between the bones in your lower back. So the picture up on the screen is kind of a general way in which this is given. Now, you've already had some medicine through your IV, so a lot of patients don't remember this really clearly. But this is given while you're sitting upright on the surgical table. Staff will be around you to support you, make sure you're in the right position. Anesthesiologist, again, will be behind you. They'll use a surgical scrub to clean the area of your back. And then a spinal is just a single injection of numbing and pain medication that's given in between the bones of your lower back. And what that does is put everything from that injection site down to sleep. That's how we are able to do the surgery. Now, once the spinal is done, the anesthesiologist will move to the head of your bed and go ahead and give you some additional medications through your IV to help put you asleep for surgery. So the spinal anesthesia doesn't actually put you to sleep, but everybody is completely asleep for surgery, whether you're having a general anesthesia or the spinal anesthesia, but you'll be given some given some medications to put you asleep through your IV. Surgery time for our hip and knee replacement patients is only really about an hour to an hour and a half typically for these surgeries, so they're not terribly long surgeries. When surgery is done, before we close the incision, the surgeon will give one additional layer of pain medication. So they'll do some injections of pain and numbing medication right around that new joint. Again, we kind of layer our pain medications to hopefully get you the best pain relief and the longest pain relief we can after surgery. Our incisions are closed underneath the skin with dissolvable stitches. Top layer of skin is typically glued, or sometimes, depending on your allergy history or your skin type, we may need to use a staple on just that top layer of your skin, but most of the time glue. If you do have a staple in your incision, those staples will be removed for you at your first post-op appointment. And I talked about this briefly, but most of you will see this dressing that's pictured up on the screen right now. It's our waterproof dressing. It's called an Aquacel dressing. It is kind of a big rubbery Band-Aid. It is waterproof and it is medicated. So it's really meant to stay in place. You don't have to do anything with it, just leave it alone. You can shower the day after your surgery. As long as you feel up to it, just let the shower water run over the dressing and pat it dry. If you have a different type of dressing, again, depending on your skin type and your allergy history, this type of dressing might not be appropriate for you. If you go home with a different type of dressing, we'll give you specific instructions on when to remove it, if you need to replace it, and when you can shower when you leave us on that day of surgery. So you'll get some specific instructions if you see a different type of dressing. Once surgery is over, we're going to move you into recovery area. First phase of recovery is PACU, or post-anesthesia care unit. This is where a lot of patients remember waking up. So that's kind of one-on-one with one of the nurses. They'll be checking your vital signs, monitor your breathing. They're going to ask you to start doing a few things as you're more awake. Taking some deep breaths for them, maybe trying a few sips of water to see if you tolerate liquids. Going to ask you to start wiggling your toes around so we can see how those medications from surgery are wearing off. A couple things that you'll learn during your PACU time. We are going to show you how to do some deep breathing exercises. Pictured up on the screen right now is a handheld breathing device called an incentive spirometer. Most people who have had surgery before or some procedures with anesthesia may be familiar with this. It's just an exercise to make sure you're doing some deep breathing exercises after surgery. That is really important, no matter what type of anesthesia you have. When we are asleep with anesthesia, we're not good at doing deep breathing. So it's really important to kind of get those lungs really fully expanded again after surgery to help prevent any fluids from settling in the lungs. That's where we hear things about, coughs after surgery or pneumonias after surgery. So the nurse is going to show you how to do this deep breathing exercise. The nurse will also do what's called a bladder scan. That's an ultrasound of your bladder. All we're doing with that is just making sure you're not sitting there with a real full bladder. And bladder muscle goes to sleep with the spinal anesthesia just like your other muscles do. So we're just going to do a scan of your bladder. It's all external just to make sure that you're not sitting with a full bladder and not quite aware of it because that bladder is not awake. Once you're able to move your legs around enough where you can scoot your heels up underneath you, lift your rear end off the bed, that's really the time when you're able to go on to your next phase of your recovery called post-op. So we'll move you to post-op. In post-op, that's really when we're getting you ready to discharge home. So we're going to go out to the waiting area, grab your caregiver. We want to make sure we start going through all your discharge instructions with the two of you. Everything that you have in your discharge packet is going to go home with you guys in writing. A couple other things that happen in post-op, we're going to give you some antibiotics. We actually give 2 doses of antibiotics for surgery, one in your IV before surgery starts and one after surgery and post-op. So you'll get your second and final dose of IV antibiotics. The staff will be busy working on getting your medications called into the pharmacy for you. Everybody having surgery will have 1 to 2 prescriptions to pick up. So we're going to get those called into your pharmacy, hopefully a good amount of time so the pharmacy has time to get those ready for you. You can pick those up on your way home. Some other things that happen in post-op is we're going to help you get dressed into your street clothes. We're going to get you up and get you walking. Rules about being up in the surgery center is you have to have a staff member with you, and we'll have a walker for you to use. So don't ever try to get up on your own. Don't ever try to get up with your caregiver. Make sure there's a staff member there. Now, we are going to have you walk a couple times with us with the walker before you leave on the day of surgery. One of those walks is going to be to the bathroom. We want to make sure that you can empty your bladder before you leave on that day of surgery. When it's time to go home, when you met all your discharge criteria and it's time to go home, we're going to have your caregiver bring the car around. Patients will wheel you out in a wheelchair, help you get settled in the car. If you have a long car ride home, it's not a bad idea to have an extra pillow in the car or two, maybe an extra ice pack. I really stress that no matter how good you feel after surgery, really we want you to swing by your pharmacy, pick up your medicines, and then head home. You might feel pretty good on the day of surgery from all the medicines you've received. We don't want you to be overactive on that day, so please just go to the pharmacy, get your medicines, and then head on home. I always recommend once you get home, you take out your discharge packet, review your discharge instructions again, and pay specific attention to your medication sheet. So depending on your surgeon and depending on you, everybody's going to have a few different medications they can take for pain. We may suggest that you take routine Tylenol and maybe routine anti-inflammatories like ibuprofen or something like that. If we have suggested that for you, it's great to just kind of get those things on a schedule. You know, taking regular Tylenol, taking regular ibuprofen, depending on what your instructions are, can really help you kind of keep pain under control, minimize how frequently you need to use those prescription painkillers. And now you can certainly use your prescription painkillers as needed at home. There are a couple times where I recommend you do get these painkillers started, the prescription painkillers. So number one time is any time at home. If you're taking your over-the-counter options for pain and you feel like your pain is not controlled, that's a time, go ahead and make sure you have something in your stomach, have a snack first. You can start your prescription pain pills really any time you need to, as long as you have something in your stomach first. So that's the first time. Second time would be at nighttime. So when you're getting ready to go to bed that first night. If you haven't had much pain in the evening, maybe you've taken some Tylenol or ibuprofen but haven't needed that prescription pain pill yet, I do recommend before you go to bed for the night, it's a good idea to have a snack. Maybe take your first prescription pain pill before you go to bed that night. Sometimes pain medication can more fully wear off over the overnight hours. That transition is always a little bit easier if you've got your prescription pain medicine in your system. And then the third time would be specific to the knee replacement patients. Remember, you had that extra layer of anesthesia called the regional or the nerve block. For most people, that's going to wear off about 12 to 24 hours after it's given. When you notice that block starting to wear off, that is a good time to, if you haven't started your prescription pain medicine, go ahead and have a snack and get those pills started. The way you typically know that that block is starting to wear off is you're going to, most people will get that sensation that their foot is waking up from being asleep. So kind of pins and needles starting in your toes, that sensation is going to kind of work at the leg. That transition from having the relief from that regional block to that wearing off can be a tough time. And again, it's always easier if you've already got your prescription painkillers on board. So big message is, whenever you decide to start your prescription pain pills, just make sure you eat first. Other things you can do for pain control is ice that incision area down frequently. You can use an ice machine, you can use an ice pack, but we recommend that pretty frequently. And you can do those ice packs about 20 minutes of every hour. If you don't love the ice or it doesn't feel great to you, just make sure you at least ice that leg down about 4 times a day. Other things you can do, get up and move around. Sometimes the joints can feel sore from just stiffness from inactivity. So we do recommend about once an hour while you're awake, get up and move around, do some type of activity. And it doesn't have to be a lot. But you know, if you're sitting in your chair, get up, walk to the kitchen and back, walk to the bathroom and back, about once an hour while you're awake. Elevating your legs to prevent swelling or help with swelling. Swelling is inevitable after these types of surgeries, but if we can keep your swelling controlled, that will also help with your pain control. So keeping good swelling under control can help with pain as well. Along with your icing, we recommend that you schedule out routine times throughout your day to lay back, get that leg properly elevated. The picture up on the top of the screen is the way we recommend that you elevate, and this is for hip or knee replacement patients. So these are 3 bed pillows turned the long way. They're kind of stacked in a stair-step pattern. Whole leg is supported and largely straight. Your toes are the highest point. So we always say toes above your nose. So if I was looking at you from the side, your toes would be above your nose, it's really key that the toes are above the level of the heart. That's going to help any fluid that wants to pool in that lower leg to get back up to your trunk where the heart can kind of take care of it. Along with icing, we recommend that you elevate the leg at least 4 times a day for about 20 to 30 minutes. If you are a person that has a lot of swelling, you'll probably hear us tell you to do that more often than that. The bottom picture is not completely wrong, but a couple things we don't like about this. We don't like the knee really bent when you're elevating the legs. That can make the knee really stiff. And when you're, we do want the toes a little bit higher. So in that bottom picture, the toes are kind of equal with the knees. That can promote some swelling in the ankle and feet. The only big, real, absolutely no with elevating is don't ever just put a pillow behind the knee only and prop the knee up only. That can create some pressure behind the knee, which can contribute to things like blood clots. So that's the only thing that we say, absolutely don't do that. But having the whole leg supported is really the best way to do it. Physical therapy, we do physical therapy in several different ways. Now, if you're having a hip replacement, most of our hip replacement patients will not have physical therapy after surgery. Knee replacements, you're going to have some home exercises that you start with, and then most of you will be doing some type of a physical therapy program. Now, that may be a program that you do solely at home. That may be going out to physical therapy. If you go out to physical therapy, most of our patients are going to start about a week after surgery. And again, hip replacements, no scheduled physical therapy. You'll have some home exercises, pretty basic things to do as well. Most of your recovery is going to be based around a short, frequent walking program, and we'll gradually increase that for you as you're getting more healed. So short, frequent walks for the hips until we make sure everything's healing well. That 2-week appointment, we're going to start to really increase your activity as long as everything's going well. What to expect from the case managers, we do call frequently, especially those first couple weeks. We'll have some type of communication with you through about 90 days of your recovery. And that can alter a little bit depending on when you come in to see your primary care, or when you come in to see your surgeon for your follow-ups. We do call on the weekends. So if you have a Friday surgery, you will hear from us Saturday, Sunday. There are a few situations where we'd ask you not to wait for us to call, but things we'd want you to call us for. If you go home and have a temperature of 101 or higher, low-grade fevers, anything less than 101 is very normal. But if you have a higher fever, it doesn't mean you have an infection, but it is something that we want to monitor for you, so please call us and let us know about that. If you do have a higher fever, one of the first things we're going to recommend to you is if you're not doing those deep breathing exercises at home that we talked about a few slides ago, believe it or not, doing some deep breathing exercises can help bring a fever down or help prevent a fever altogether. If you're going to have a fever, typically you're going to see those in the late afternoon, evening hours. Again, anything less than 101, typically nothing to worry about. 101 or higher, please call us and let us know. If you feel like your pain is not under control with the medicines you have available, you will have some pain with recovery, but it should be controlled. If you feel like that is not the case, give Katie or I a call. We're going to help you work through that. We are nurses, so we cannot prescribe new medications for you, but we can, talk to you about how to schedule those medicines or how to take them differently. We can certainly get in touch with your provider if it's truly a situation where you just need a different medicine. If you have any concerns about your surgical dressing, the skin or area around your incision, or the incision itself if you're able to see it. We have patients that send us pictures all the time, so just call us and let us know if there's anything that you're concerned about. We usually just say, hey, send a picture over, we'll take a look. Then the last two things are going to be a little bit more serious, but things we very rarely see, blood clots and reactions if you have a spinal anesthesia. So blood clots, warning signs of blood clots are pain in the calf muscle, so that big, large, meaty muscle on the back side of your lower leg, along with swelling in that lower leg, so your calf, knee, ankle, toes, that does not improve with proper ice and elevation. So pain in your calf, swelling that doesn't go away in that lower leg. Those two things together can be warnings of a blood clot. If you are concerned about that, call one of us. We'll talk about your symptoms. If we're also concerned about that, then we will go ahead and order what's called an ultrasound or a venous Doppler of that surgical leg. We're going to set that up at one of our locations where you can come in and have an ultrasound done of your leg so we can make sure that there's no blood clot. And then the very last thing is reactions to a spinal anesthesia. So if you have that spinal anesthesia as part of your anesthesia, you've probably, if you've heard of a spinal, you've probably also heard of a spinal headache. If you go home and have a really nasty, persistent headache, it's better when you're laying flat, worse when you're upright. Your normal medications for headaches don't work, like your Tylenol products or your painkillers. It could be that you're having a reaction from the spinal anesthesia. Please call one of us and let us know. Even less frequently, any changes in your vision. Again, those high fevers, 101 or higher, any difficulty emptying your bladder once you get home after surgery. Your caregiver looks at your back or the area where that injection was given for the spinal and sees any drainage. It looks red, it looks swollen, it looks angry back there. And then finally, if you have any recurring numbness or tingling in your legs. Now, the immediate surgical site is going to stay numb for quite some time. But for instance, if you had that nerve block from a knee replacement and you got that tingling in your toes, we wouldn't expect that to be, coming and going for several days. So if you have recurring numbness or tingling in those lower extremities, again, these things are very, very rare. Probably the spinal headache is what we see most often, and that's very rare. The rest of these things is just almost unheard of. But if any of these things occur for you, please don't wait for us to call. Please call Katie or myself. What we'll do is we'll get in touch with our anesthesia department, and they'll kind of take over care from there to make sure we get you feeling better. And that's all the information I have for you today. If you have any questions, again, my name's Sarah. I work with another nurse, Katie. I'm going to go back to our contact information slide one more time for you. If there are any questions that come up for you before surgery or after kind of absorbing the information from class, feel free to give Katie or myself a call anytime. Get back to that screen real quick. All right, and have a good rest of your afternoon. Thanks again. Bye-bye.